Hi, welcome to Health and Information. This is for November 2016. This is our Miracles V, the fifth series of, we're talking about different miracles that have happened in offices and in our office specifically for this month. And we've got 5 people that are going to tell us about specific things that they've experienced in their treatment programs. And I think you'll find some of this rather interesting. We go pretty much the whole gamut of different things. Some of them you don't necessarily correlate to chiropractic care, but what we've learned in the previous ones is that people are amazed at what type of things that they're able to get results with as we come into the office. And so our first one, we're going to talk to Bridget, who is going to tell us about Jose. Bridget, thanks for joining us.
Thanks for having me.
Tell us the story about Jose.
Jose was at work and he was on an 8-foot ladder and he slipped and fell and crushed his left leg in 15 places from the knee down. He had to have 2 surgeries. He's actually about to have 2 more. He started his physical therapy with you and he's progressed a lot. He can walk on it now. It helped with his pain.
Well, what did they tell him was his prognosis?
That he probably wouldn't be able to walk for about a year.
Okay, and it's been about how long now?
He fell in November of last year, November 21st.
Okay. Now, was that his only injury?
No.
No. What was the other one?
He fell November 21st and broke it 15 places from the knee down. And then he fell again March 8th and broke his femur in half.
Okay, so was he walking at the time that he had the second fall?
He had just started walking. He had been walking for 3 days.
He doesn't like to walk.
No. He had been released from the doctor to start walking without his crutches. And he was in the garage and he slipped and fell and snapped his femur in half.
So now, let's go back to that one. What did they do after that then?
After he fell and broke his femur?
Yes.
They put a metal rod from his thigh to his knee.
And then he was back on crutches?
Yeah. He was back on crutches and more physical therapy.
Okay. Now, how has what we've done here, now we've done mostly rehab and strengthening to try to get those muscles working better again afterward. But what have you seen there and that maybe would be not what you would have expected?
The movement in his leg. The doctor said if it wasn't for his physical therapy, he wouldn't be able to bend his knee. He still can't bend it all the way, but he can, to a sitting position. But they said without the therapy, he would not have been able to bend his knee at all. He has metal from his thigh to his ankle. They also said that the muscles in his leg, without the physical therapy, would not have strengthened. They're going to keep him on the physical therapy, but he goes back for 2 more surgeries. And through those surgeries, they want to see, I guess, more progression for his upper and lower muscles. But he definitely would not be able, the doctor's words were if he wouldn't have went through physical therapy or the rehab, he wouldn't be able to walk on his leg today.
And that's not been quite a year since the first one.
No, he was, let's see. It's basically been since March because he restarted everything in March all over again.
Right.
From falling.
Okay, and for those who don't know, what we're talking about on the rehab is using the bands, the light and the heavy bands, to be able to strengthen the muscles, to be able to exercise the muscles. And in the case like with Jose, what we look for there is for to try to balance as much as possible from the front to the back, from the left to the right, the inside to the outside. Well, in the legs, what we want to do is get as much mobility in there so we go through all the range of motion that we can go through in order to facilitate the strengthening of the muscles to be able to allow the normal function in there. And although he may never have 100% function, especially after the second injury, he's going to be close to it.
He was also able to go back to work sooner with the physical therapy.
Okay. Well, Bridget, thanks for taking the time and sharing the story with us.
You in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bisland at Bisland Chiropractic, where you can get your first visit free this month. Call Bisland Chiropractic at 838-4252. Bisland Chiropractic.
Okay, welcome back to the Chiropractic Miracles. This is version 5, November for 2016. And the next story we're going to talk about is more of a typical back pain, but also there's a lot of internal conditions. Most people don't realize that we do work with internal organs, internal conditions, because as the nerve supply goes from the spine to the different parts of the body, a decrease in nerve supply will cause a dysfunction of that particular type of tissue or area of the body that nerve would supply. So I want to introduce Tamara, and Tamara's had a really interesting experience. And first of all, thank you for joining us.
Thank you for having me.
And the thing I'd like you to do is just tell us your experience and what you were going through before I saw you.
Well, I was experiencing a lot of pain. It would shift from my left to back. Literally, I had pain in my butt. And a lot of people would think it was my sciatica nerve, and really what it was my piriformis muscle. I think that's how it's pronounced, correct?
Yeah, piriformis, yes.
Piriformis, okay. So it was I was really in a lot of pain, and I was like, okay, I gotta go see. I'm going to a chiropractor again, and that's what got me here. And I got treatment for more. I have had neck surgery, 2 neck surgeries. I've had hip replacement. So I did, and even though I've had neck surgery, my second one after 15 years was last year. I was having a lot of headaches as well again. So
you've had a variety of problems there as well.
yeah, I'm always an interesting case for doctors. It's your challenge, something like that, really.
Well, it is important for people to understand that even after surgery and even after hip replacements and even screws in the spine, we can still work with the person because we're able to go in and go around them. Now, obviously, we don't go in and manipulate or adjust the vertebrae that are fused together surgically, but we sure can go above and below it to facilitate the correction, because when you have a surgery, a lot of times that spine will become hypermobile above and below the surgery and can create pretty significant amounts of pain and problems there as well. And by correcting that, we keep that from deteriorating and requiring future surgery.
Right. Something else I found out when I got here and shared with Dr. Bisland that I had issues, problems with, was irritable bowel syndrome. And that's something he's been able to help with and treat as well, in conjunction to, the pain. I'll tell you what, ever since that first treatment that I had, I have not had the pain in that, like that. And I started coming in March. I can also testify, if you're not finishing my treatment, I thought that after several months I was good, had what I could, got what I could get out of it, and 2 months later I was back here seeing Dr. Bisland and to finich out my treatment. And I may need to be one that will need to come in once or twice a month at most for maintenance, but it's nothing like it was before the pain. But after March, I guess, to around June, it was. I took a couple months. It took me a couple months to realize I still needed Dr. Bislin's treatment.
Now, you were talking about the irritable bowel. Tell us what you have seen change in that since we started working on that.
Well, more so the second time, coming back, I just don't have the extreme episodes with my irritable bowel that I did. I still sometimes have some issues. Sometimes that's just because of some anxiety and stress or something I've eaten. But it's just gotten better. There have still been some flare-ups, but they're decreasing. And it's like, Dr. Bislin said, it's a process, and it doesn't happen overnight. It can take some months, to get better, through the process of therapy, chiropractic care, what have you. Anything, sometimes you're doing it. It's a process. It just doesn't happen overnight. But it's just continued to get better as far as, yeah.
Right. Well, thank you.
That has the extreme issues.
Thank you for spending the time and telling us your story.
Thank you.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine or some front office drone? You know what I mean. You wanna talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected. We're Murray Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected. We're Murray Electric.
Okay, well, welcome back again, and we're going to start talking about another story that's rather interesting. A lot of people will ask me questions throughout the day, and I try to answer them when we do a program like this, because hearing it from somebody other than me usually tends to make a little bit more of an impact. And they ask me, how young can we treat a patient? Well, my answer to that is as quickly as we can after birth is just about right. And I've told this story before on our program, but Thomas got his first adjustment. He was 40 minutes old, and he's been adjusted for regularly ever since. Our next story is going to be about a little girl, and this is a pretty dramatic story, and we're going to talk about that. So I'd like to introduce Sarah, and Sarah's going to talk to us about her daughter.
Thank you for having me.
Thank you.
My daughter was about 2 weeks old by the time we brought her in. She was born with a major foot dislocation to where her foot was just folded backwards against her leg. After 2-3 weeks of coming in about 3 days a week, she had a perfectly normal foot. No problems at all.
And what did they tell you was her problem?
They told us that if we didn't do it, they were just going to let it sit and let it heal on its own. They told us by the time she started walking that it would just naturally correct itself. And by then, the damage is permanent and it's almost impossible to reverse. So we brought her in here, and you did an amazing work. She is a healthy girl. She'll be 3 in February, and she is running as fast as she can.
That we can testify to on a
Yes.
regular basis, yes.
Yes.
So what have you seen, what other things have you seen with her over the course of now going on 3 years?
She's a lot happier. She's had a bunch of falls and scrapes, and she's been in a lot of pain before every time she falls, because she'll bang her head on the coffee table like any normal little kid. And every time we bring her in, she falls right to sleep on the way home. She's just in no more pain.
And you know, the important thing of that is that the quicker we can find a problem, the quicker we're able to get it corrected. And of course, what Sarah does is she'll bring her in pretty quick afterward, or as quick as is possible after a fall or an accident or something. And what's going to happen with her as she grows up, she's not going to develop the spinal curves, the scoliosis, the unlevel pelvises, and the other things that children will normally develop by falls and slips and trips and banging heads and falling off of couches and all these things that we've all seen our kids do over the years. And the other thing I was going to ask you about, Sarah, is that you've noticed, we're going to switch gears here to you now. You've had a problem with your wrists. Tell us about your wrists.
Yes, about 3 years ago now, my husband and I were in a car wreck, and my hand was over the horn when the airbag deployed. So it forced my hand back against the back of my right arm. I went to a specialist, and they told me that everything was fine. My muscles were just sore, and it could take up to a year for it to heal. Put me in a cast for 6 weeks. My wrist was immobile, and I went to Dr. Bislin. He felt it and immediately told me that it was just out of place. As soon as he popped it, my pain was instantly gone.
Now, with an injury like that, I like to use a paper clip to demonstrate this when I'm here in the office with people. But once you bend it completely like it was, once you bend it out of place, it's never going to be as strong as it was before the injury. And so there are certain cases, like Sarah's, that we will find that the weakness of the joints and the misalignment and the stretching of the ligaments and all is actually probably a permanent type condition. And it is a weakness that can't be corrected generally, and it's a weakness that even surgery won't correct. So it is a maintenance type situation on that.
Yes, I found out recently that I have to come in at least every 2 weeks to get my wrist adjusted. Otherwise, my hand is just in severe pain.
Well, thank you for sharing with us.
Thank you for having me.
An accident can turn your life upside down. Immediately, you may face problems like who will treat your injuries? How will your car get fixed? What are you going to drive in the meantime? You need solutions now. At Benedict Law Office, the care you deserve can begin at your own home. No office visit is necessary, and you pay no fee if there's no recovery.
At Benedict Law Office, there are no problems, only solutions.
Call Benedict Law Office for your free consultation today.
Okay, well, welcome back. We're continuing to talk about miraculous things that we have seen in the office here over the more than 22 years I've been in Tulsa, and over 30 years that I've been in practice overall. And you know, one of the things that we've had several people now, we've talked about post-surgery, and we're going to talk about that here again in just a minute. But after surgery, the spine is always going to be weak. And majority of people who are post-surgery who have to have continuing care will ultimately, in a lot of cases, have to do that probably the remainder of their natural life because of the weaknesses that have developed in there. And this next story, I wanted to introduce to you a gentleman who fits that category very well, and I'd like to introduce Jim. And the first thing I'd like to do, Jim, is just tell us how everything started with you and that low back and your surgeries and so forth.
Actually, I think it goes back to high school days when I was playing high school football. I'm an old-timer, so the rules were a lot different back then. Blocks could be done with like what we call flying blocks. You could leave your feet. You were allowed to block people below the waist. And I was playing on a punt return team one night, and as I was going down the field, I saw a guy coming toward me from the side, so I turned a little bit. Well, I turned the wrong way, and he hit me at the bends of my knees. And I think that was where my problems first started. And as the years went by, I progressed into a lot worse situation.
Okay, so then as you got older, what happened?
As I got older, it progressively got worse. About 11 years ago, I got to the point where I could not walk. I was using a walker. I still couldn't get around very well. Several people suggested a chiropractor for me. And I like to brag that I had Thomas as a 6th grade student a couple of years ago. I got acquainted with the business while Thomas was my student. They were very, very easy people to work with and everything. So when I decided on a chiropractor, I automatically called Dr. Bislin's office to get an appointment. I came in, the first day I came in when Lisa was taking me back for the x-rays for the exam, I actually fell down even when I was using my walker. So I went from there. Doc worked with me for about a year. I was able to actually walk without my walker. I was getting around real well. Doc doesn't know this, but I was working in my azalea bed one day. I got my feet tangled up. I fell, I twisted, and that's when I messed up what you had done for me over the last year. Mm-hmm. Then we looked at it and we decided that probably surgery would be the only option. So I saw a spinal specialist. He did surgery on me. Didn't have to do fusion or anything, just went in and cleaned out the vertebrae. After I got pretty much healed up from that, I started seeing Doc again because I was still having problems. The surgeon that did my surgery said that the next option would be a fusion. I said, no way on that. So Doc and I discussed it. For the last 10 years, Doc has been treating me. I have not been to a surgeon since.
And you're walking?
And I'm walking.
Now, what did they tell you was the cause of the pain that you were having medically?
Evidently, one of the discs was bulging. It was pinching my sciatic nerve. I was to the point when I would try to stand up or get out of bed, I would scream. My neighbors told me that they could hear me sometimes. They worried about me at first until I explained to them what was going on.
Okay, so now, how would you describe how you're doing now compared to 10 years ago?
Well, I'm 10 years older, so I can't do what I used to do. But actually, Doc has kept me from having this fusion surgery. I'm able to do about anything I want to do. I can't lift any heavy objects now. I know better than to try that. I did an oil change on my car Saturday. Unfortunately, I twisted and turned a little bit, so I was a little bit stiff tonight when Thomas started working on me. But I can do about anything that a 70-year-old can do, or actually a 74-year-old.
Okay, well, Jim, we thank you for your story, and we appreciate you taking the time to do it.
Thank you for having me.
You in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bisland at Bisland Chiropractic, where you can get your first visit free this month. Call Bisland Chiropractic at 838-4252. Bisland Chiropractic.
All right, we're going to continue. We have our last story, certainly not the least, but the last in the 5 that we have with us this month on our program. We were talking earlier about internal conditions and how the nerves can affect the parts of the body. Wherever those nerves go, if we've got reduced nerve supply, we're going to have reduced function. I didn't mention earlier, and I want to mention it again. It's been on several of our other programs, but it takes the weight of a nickel to reduce the function of a nerve by more than 50%. And that is a really crucial thing that we need to keep in mind, because everybody thinks, it was just a minor problem. It just got a little pinched nerve. There is no such thing as a little pinched nerve. Somebody told me last week they were in a minor car accident. It was only going 15, 20 miles an hour. Anything more than 5 miles an hour can certainly lead to a interference in the nervous system. One of the things that intrigues me about this story is that most people would never relate the symptoms that my next guest is going to talk about to improving with chiropractic care. But I think Vicki would argue that point. Vicki, welcome to our program, and thanks for taking the time.
Thank you.
Tell us a little about your story.
I have what's called Meniere's disease. And Meniere's disease has no cure. They're not sure what causes it. Multiple people have said it's fluid imbalance behind your inner ear. Whatever it is, I can tell you it's horrible. The way I found out was in 1997. I got up one morning to go to work, walked a few feet, and fell flat on my face. And I wasn't able to walk again for over a week. I could crawl after a few days, but mostly I had to be carried. And there's nothing they could do. They give you a medication called meclizine to help with the spinning. I have egocentric type spinning, in that I feel I'm spinning inside my body. You're still, but I'm spinning. And it doesn't help to lay down. It doesn't help to sit up. There's nothing you can do. You feel like you're falling at all points, even when you're laying down. A therapist taught me a few things about holding on to a wall, because I know the wall's stationary, and it try to refocus my mind away from that falling sensation. And another bad thing about it is it damages your hearing. 2 years ago in October, I had a severe episode that lasted about a week. It's episodic, it comes and goes, but you don't know when it's going to come and you don't know when it's going to go. Well, it damaged my hearing to where I now wear 2 hearing aids. My left ear is affected worse than my right, but permanent hearing loss is part of this disease. Well, this last summer, I happened to know the Bislins in a friendship way, and knew about Dr. Bislin and his business, but I'd never been to a chiropractor. And I was sick with Meniere's, and to the point of being carried to the bathroom. I couldn't eat. You're constantly spinning. I can't describe how sick you are. But anyway, I had put it on Facebook, I believe it was, or something, and Thomas saw it. And Dr. Bislin had told me about chiropractic, and, I think I might could help you. And, and all of the things that you can read on the internet, chiropractic is not mentioned. They tell about all these different specialists, but they never mention the chiropractic care. But I'll tell you what, I thought, I've done everything, and here I go. And I came up here, and for months, it's been months, that they have worked with me, trying to help me get my balance, even trying to do some of the exercises, triggers my Meniere's disease. In fact, I went over and jumped on the trampoline and about did myself in. I can't do that because it changes the pressure in my ears. So anyway, Dr. Bislin has been treating me, and it's just been a gradual thing to say, but when I start having the symptom of a Meniere's disease attack, it is so small now. Used to, it would put me to bed. I fall in public. I fall everywhere. But these symptoms since June have gradually decreased. And so when I come in, I've been coming 3 times a week all these months. And so when I come in, he'll ask me, how have you been? And I can tell him, if something's going on. Now, I got to tell you, the treatment for it is not always fun. I do not like having my neck popped, but that has really helped because I have some vertebrae that he feels might be pressuring this nerve to my ear. So anyway, he's been adjusting all that. We recently went to on a trip. We flew, and I actually rode on a ferry. I didn't get sick. We had a great time, flew back, still had a great time. And so this has been a gradual, progressive treatment. that is not even mentioned in anything on the internet. But I'm here to tell you it's helped me. It makes a difference on whether I can work and my quality of life. So it's much appreciated.
Well, when I first heard that she was having that issue, as she said, there's no cure for Meniere's, but I've had experience with 2 other people over the last 30 years that have both gotten results very similar to what she just described, based upon what we're doing. And actually, I've lost track of some of them. The first 2 were in Florida, so I don't know what's happened with them since I've been here. But the results are just very, very gradual. However, it's not, we're not running a race here or doing more of a marathon in a case like this, because we've got a lot of interference going on in there, a lot of things going on in the inner ear with the fluids and so forth. But we've had a couple cases of vertigo. Now, they weren't Meniere's, but we've had a couple cases of vertigo that have come in. In fact, Vicki referred one lady in for that same symptom. Fortunately, and I'm really grateful for her that she didn't have the Meniere's, but we've been able to get that resolved as well. So it is a very tough case, and it's one that I'm kind of proud of the results she's getting with it so far. And the thing we're trying to accomplish now is to balance and coordinate the spine so that when we start reducing and releasing her from treatment, that it's not going to pop back into its normal alignment, which is what the body is used to. What I'm saying, normal alignment for her would not be normal alignment for the average person without the symptoms. The body will tend to want to reverse itself and put itself back into its comfortable alignment, even though it isn't the proper alignment, but it's normal for her in that particular situation. Okay, we'll be right back and close our program.
An accident can turn your life upside down. Immediately, you may face problems like who will treat your injuries? How will your car get fixed? What are you going to drive in the meantime? You need solutions now. At Benedict Law Office, the care you deserve can begin at your own home. No office visit is necessary, and you pay no fee if there's no recovery.
At Benedict Law Office, there are no problems, only solutions.
Call Benedict Law Office for your free consultation today.
All right. Well, thank you for watching it, and welcome back to Health and Information. We're at November of 2016. We're into our 5th year of actually doing this program, and over the years we've had a lot of stories on Chiropractic Miracles, and you can find all of our programs, by the way, at youtube.com and search for Bislin Chiropractic. We have our YouTube page there, and all of our programs are on there, including all of the miracle ones. We have a couple with former patients. Some are still current. We have some with doctors from across the country who have told us about miracles that happen in their offices. And those of you that are sit in our reception area, you will probably occasionally get to see them as they play on the chiropractic news service out front. So I'd like to thank all of our participants tonight, and I hope that somebody has said something that has enlightened you and given you some perspective on maybe some things that we can do that you might not have known about. And until next month, I'm Dr. James Bislin. Have a very happy, healthy, and safe month.